Hi, this is Dr. Antolak from thegentledentist.com in Shelby Township, Michigan. And I respond as the gentle dentist because the fact that people may claim to be gentle, but this is something that we've proven in and out, and our patients have really said a lot about that. That means even when placing dental implants, we do the best we can to be as gentle as possible. What I want to do is to describe what a dental implant is and then show you how that would work on a model. So this is for example, a model of what a patient's mouth would look like, okay? And they have missing teeth. And what I want to do is to show you there's been an implant that's been placed in the bone here, or this artificial bone. And but I do want to show you what an implant looks like and what this is about. Okay, so this is a dental implant. When we put it in the mouth, we use it like this. Just do this for a second. And so what happens is once an implant is placed in the mouth, we can take a little, it's made out of actually three different sections. One is called the implant itself, and one contains what are called the abutments. So this is the implant itself. The small little part right here is called the abutment. Okay, that goes inside of the implant. It goes in and snaps inside, and then there's a little screw. For example, this one right here, there's a little screw that combines the two of them together like that, okay? And so once that's placed in there, that becomes what the implant would look like right there. For example, when an implant is placed in the mouth, in the jaw like this, we place the abutment, like I just described, into here. We actually screw that into the bone itself. And then what we do is then we actually torque it with a special instrument. And this is called a torque wrench. This is actually what some of the instrumentations we use. Obviously, we sterilize our instruments before we do anything, and they remain sterilized with Treat. My assistants are going to like this because I did this. No, just kidding. So what happens is these go on in the right over the top of where that implant is, and then we have the ability then to put it on and then what we do is when we torque it, we can actually, as this bar moves, it'll show us how much pressure we're using to apply to put into that bone to make sure that it goes in with enough resistance so that that'll remain stable, and then we can have the bone grow into it. Once this is in place, we basically cut off this section right here, this green section, and that becomes what would look like after a crown would be done, or a cap would be made. Then we can have an artificial crown placed over the top of that, and that ends up being your tooth that has been missing. So that's kind of an overview of how it works, some of the instrumentation that we use, and the fact that dental implants are an awesome way to really replace missing teeth. They're also really great for holding dentures down in place that have for years have been loose around, so we can place an implant, sometimes just a couple of them in the lower jaw here, and we use something that'll actually snap over the top of that implant, and they'll hold those dentures nice and tight. So if this is the kind of way that you're thinking about possibly of replacing your missing teeth, this is what we can do as a dental implant. Thank you. If there's any questions, you can call us at 586-247-3500.